Hey everyone. So today we want to talk to you about building low capacity through the neck flexors. Okay, and this is a topic that is actually quite controversial across research and across social media because, firstly, we think it's because a lot of the research that uses these deep neck flexor exercises, they use them on large groups of individuals experiencing neck pain without actually, assessing the unique individual needs of the client. Okay, so again, trying to look at single exercises and single exercise effects on a pain experience around the neck is really helpful. Secondly, um, a lot of individuals that use these exercises place far too much focus on trying to selectively activate the deeper intrinsic muscles of the anterior neck while trying to simultaneously inhibit the more superficial muscles. Okay, and that's just not something that's been shown to be expressed across the research. And it's also, if you work with clients with neck pain on an everyday basis, you'll realize how difficult it is to actually have the clients firstly perform that in clinic, but then secondly try to continue to reproduce that at home when they're not in the clinical setting. So it's very, very difficult. So what we want to try to do in this video is simplify the implementation of these exercises by trying to appreciate the direction dependent nature of those muscles that act to flex the head, and then by appreciating the integration between the two key segments in the sagittal plane, the rib cage and the head. Okay, so really important to consider those two joint segments. So let's look at the video here. And one of the constraints that we need to consider here as well is that typically we're doing this on a treatment table. Okay, we're typically doing it on a table where obviously the pelvis, the rib cage, and the occiput is in contact with the treatment table. So one key thing to understand here is that when the rib cage flexes, against the constraint of the table, you'll naturally see that head begin to extend. Okay, because again, when we flex the rib cage and the thoracic spine, that's naturally going to create a flexion through the upper thoracics and the lower cervicals. So to keep the occiput on the table, the head will naturally have to extend, and that's not really going to create a behavior in those tissues that act to flex the head to allow them to experience load, higher levels of load. Okay, it's going to be quite difficult and quite uncomfortable for the clients to try and lift their head from this position, okay, and experience load through those anterior tissues. So what we need to do is we need to create more of an extension of the rib cage or an extension of the thoracic spine. And we like to do this by driving the elbows down to the table and then using that to get leverage to try and drive some thoracic extension and rib cage extension to get some extension into the upper thoracics, lower cervicals, which will help assist the capacity of the head to flex. Okay. And then all we're typically doing here then is continuing to add an upper cervical nod. But again, it's much easier to add that upper cervical nod, that head nod, while the upper thoracics are expressing more of an extension behavior. Okay. Then we're going to lift the head from the table, hover the head from the table, hold for 5 seconds. And we typically like to ask clients to do this for 5-second holds for at least 6 to 8 reps at a time. Okay. Now, sometimes this is even difficult for the client as well, because many clients may have difficulty expressing that thoracic and ribcage extension. So it's still challenging for clients to get into a position where they can flex the head, get some length and some flexion into the upper cervicals to then drive that load into the anterior portion of the neck. So what we can do is we can regress slightly and help facilitate that more concentric behavior into these anterior tissues. Okay. And what we like to do is to actually bridge the hips to help extend the spine from the bottom up. So everything below the neck is extended. And all that does is it brings the rib cage closer to the head. Okay. It brings the attachments, the rib cage attachments of these flexor tissues closer to the head. So it just makes it much easier to get that load into the anterior tissues here and experience that load through the neck flexors. Okay. So you'll see that here. The rib cage comes much closer, much easier then to get that head into a flex position and then drive that load into the anterior tissues by lifting the head from the table. Okay. Now, obviously, we don't want to only be able to get load into the neck flexors by bridging the hips up and extending the whole spine underneath the head. It's just more of a regression to help facilitate that capacity to experience load here. So if the intention from a clinical standpoint is to try and help the client experience load through these tissues, then we can manipulate the segmental behavior of the surrounding joint structures to help facilitate that muscular behavior. But we obviously want to get to the point where, we can perform that by, getting more isolated motion through the rib cage and thoracic spine, and more isolated motion through the head flexion. So we're actually getting more of a dissociation between the rib cage and head while we get load into the neck flexor. So the rib cage and thoracic spine is extending as the head is flexing. Okay. Whereas the bridging up, the extension of the spine underneath the head to bring the rib cage closer to the head is just more of a regression to facilitate the capacity to sense load, sense forces moving through these tissues. Okay. So again, from our perspective, a much more simplified way to view the load, to build low capacity through these neck flexors, instead of trying to selectively activate deeper muscles and inhibit the more superficial muscles, because it's just very difficult for the client to reproduce that at home. But again, a much better framework to use here when we understand the behavior of muscular tissues within the context of the behavior of the segmental structures that those muscular tissues attach to. Okay, and we can see how we can progress and regress based on the coordinative challenge of those segmental interactions. So hopefully that helps, and there'll be plenty more videos coming soon. Thanks for listening.